Achieving health equity requires ongoing efforts to address historical and ongoing injustices, as well as the elimination of health and healthcare disparities. I really see our work as uplifting voices and experiences that might otherwise go unheard in policy discussions.
Having high quality disaggregated data by race ethnicity is key to addressing health inequities. You need to be able to identify the disparity in order to address it.
Data are really the cornerstone of our ability to be able to address disparities and advance health equity. Historically, we've lacked comprehensive quality data by race and ethnicity, which really limits our ability to get a complete understanding of the experiences of the population and where those disparities exist.
There were anecdotes, so you may have known about an aunt whose child died, or someone down the street or in the church who had a negative outcome, but to actually know the scope and the data, I don't think was common knowledge 10, 20 years ago.
So disparities occur across a broad range of dimensions, but when we look specifically at disparities by race and ethnicity, which is a focus of much of the work of our program at KFF, we see in particular that Black, Hispanic, and American Indian and Alaskan Native people tend to fare worse compared to their white counterparts across many measures of health and health access.
These data are more than just numbers. We aggregate these numbers and we come up with a rate of this or a percent of that, but each number that contributed to us getting to that statistic really represents a person's story.
If we look at efforts to advance health equity, certainly that encompasses addressing some of the social and economic factors that influence health. It includes factors that influence whether or not people are able to access or gain entry into the healthcare system. But then there are also a set of factors to consider once people are within the healthcare system regarding differences in the care they receive and treatment by providers. I've personally witnessed within my own family and among family members them experiencing differential treatment in the healthcare system. So I've seen what this looks like at a personal level in terms of people receiving different treatment based on different circumstances, like maybe the language that they speak, maybe the provider's perceptions.
There are definitely challenges in trying to have conversations around racism and its role in health and healthcare. There are always going to be questions around, well, is it really that? Did you look at this? Did you look at that? And so trying to show that relationship to be able to then have the data to inform our policies and programs is important.
Right now is really an important opportunity for work to address disparities and advance equity, given the broader attention and focus on these issues, as well as the increased allocation of resources more generally. So I'm hopeful, but I also recognize that it's going to be a long, challenging road and require a lot of effort across different sectors.